Hi, I'm Mike. I live in Louisville, Kentucky, and right now I'm 59 and a half years old. Yeah, I just turned 55 when I had my HIFU. I was treated at the Galena Hospital in Cancun, Mexico. I was diagnosed with prostate cancer right before my 55th birthday. My decision-making process. My wife and I did quite a bit of research on the different treatment options. We looked at radiation, we looked at surgery, and we also looked at a HIFU. Uh, the conclusions I drew after all my research were that the older you were, they tended to recommend radiation. The younger you were, they tended to recommend surgery. Then we looked at the side effects, and the side effects the side effects with radiation were all similar with uh, sexual function and uh, incontinence and that kind of thing. And the conclusion I drew were that whatever side effects you had at the conclusion of the procedure was pretty much what you were going to live with. Um, and they may even degrade. The same with surgery, that whatever side effects you had at the conclusion of the procedure, you could probably expect not very much improvement. The conclusion I drew with HIFU was that they had some of the same side effects, but maybe a little bit less, and that over time there could be some improvement in those side effects. So that all those conclusions that I drew entered into my decision-making process. Why I chose HIFU as opposed to radiation, it was a one and done thing, not a long drawn out process. Over surgery, just thought it was a better option. The surgery seemed more invasive and more radical. My recovery was relatively smooth. We came out of the procedure with a catheter and a urine bag, and that lasted about 2.5 weeks. The the procedure went smooth. I had no complications. As far as using any kind of uh, aids like Viagra and that kind of thing, I had just started to use those before the procedure, so those still are in my regimen. I'm doing very well today. Quality of life is good. Have no issues with uh, functions of urinary and that kind of thing. I have no issues with any other kind of problems. I really feel like at 59 I'm in better health than I was 15 years ago. Uh, I would give advice to anyone that's diagnosed with prostate cancer to really find a urologist who's going to explain all the options to you. Uh, get some information as much as you can on all the different treatment options. Discuss those if you have a partner, get them involved, and make a decision that's best for you. Whether it's put quality of life first. I know there's other issues as far as time and travel and cost, but really give it a good consideration and find the option that's best for you.